I think that it's inevitable that we will have to take help and support from private healthcare, especially for those individuals who can afford it, because the waiting times, like you said, are dire. You could be waiting 2 to 3 years sometimes for an ADHD assessment. As you know, students in particular who are suffering from ADHD are unable to perform properly in their exams, and that sets them back. So it's very important that we be more accepting of the fact that private healthcare is here to support the NHS.
Welcome to Health Chat, the UK's #1 health and social care podcast. We discuss the most important issues in the healthcare sector and the challenges our colleagues face from the front line of delivery to decision making in the boardroom. Join me, your host, Dr Atif Ghaffar, as we speak with interesting people from across health and social care and bring you expert insight and discussion on the topics that matter most to healthcare professionals. Hello, welcome to another episode of Health Chat. I'm Dr Atif Ghaffar, your host and medical director at Health Group. I'm super excited to be here at the House of Health, and I'm with its founder and chief medical officer, Dr Anita Raja. Dr Anita has been practicing as an NHS GP for about 5 years, and she founded this glorious private clinic in the Jewellery Quarter in Birmingham. And we're going to discuss aspects to do with holistic integrated healthcare and much more. Anita, thank you so much for joining me.
Thank you so much for having me on your show today.
Firstly, I wanted to congratulate you on such an auspicious clinic. It feels like we're in Dubai, Qatar, somewhere in Harley Street, and you've transformed, you've really brought to life something that is really 21st century and multinational in the heart of Birmingham. So congratulations for that.
Thank you so much. I'm extremely humbled by your kind words.
So I wanted to first ask you, the House of Health, so you've been instrumental in introducing premium holistic medical healthcare for all patients. What inspired you to start this journey?
Well, there was a huge market gap. There was no such clinic around, and holistic healthcare is the future, as we all know. We're going back to using turmeric for fighting inflammation. We're going back to mindfulness, just sitting in a park, listening to the birds chirp, looking at the sky, and we now know that there's a lot of evidence that holistic healthcare works. And when we look at the way we have planned our clinic, it's an integration of modern Western medicine along with holistic care, where we are offering a very personalized approach to our clients, to our patients, and the approach is bespoke to their needs. So it's catering every individual according to their needs, because unfortunately one size doesn't fit all. So if someone who is sort of morbidly obese walks into our clinic, we don't just, and has high cholesterol and has diabetes and lots of other conditions, we don't just say, polypharmacy, let's add this, but we actually look at the root cause. Because, I myself have a keen interest in longevity and lifestyle medicine. And when we look at that pyramid where we are looking on how we can increase our health spans, it needs to look at a lifestyle modification, sleep modification. It needs to look at your diet, exercise, your hormones, everything. And that is the package we want to give our clients, our patients.
It sounds like complex needs requires a lot of intense and complex solutions. Not that the solutions are complicated, but they take time, they take a lot of investment. Probably very difficult and challenging to deliver that in an 8-minute NHS consultation.
Definitely. And I guess coming back to your question, that was my inspiration to set up a clinic where I can give my patients more time, where I can listen to their queries, where I can be more mindful of their needs, and I can assess them properly. The lack of time within the NHS setting was a big driver for me. I absolutely love chatting to my patients. I'm a very chatty and nosy GP. I want to know everything that is happening in their lives. And I think the way I consult is not formal in the sense that there is no sense of hierarchy. I am there to listen to them. I am their clinician. I really want to help them. I'm their friend as well. Within the House of Health, we we have a team of world-class leaders. We've come together. I've got a team of dietitians, health coach, mental health coach. Our mental health coach is a very experienced GP who has more than 30 years of experience, and we look at different conditions from a very bespoke angle, because we want to make sure that we don't just, dump medications on patients. For instance, if someone is coming in with depression, yes, of course we can give them some SSRI and everything, but why not look at the broader picture? And that is simply not possible within an NHS setting anymore.
Mm-hmm. Mm-hmm. So they've tried doing this within the NHS, and we can see the use of things like social prescribing, referral to community mental health teams, CAMS for children, young adults. But in practical experience, they take ages for patients to be seen. So I totally understand the integrated approaches of the future. Where do you see this developing later on?
I think that it's inevitable that we will have to take help and support from private healthcare, especially for those individuals who can afford it, because the waiting times, like you said, are dire. You could be waiting 2 to 3 years sometimes for an ADHD assessment. As you know, students in particular who are suffering from ADHD are unable to perform properly in their exams, and that sets them back. Mm-hmm. So it's very important that we be more accepting of the fact that private healthcare is here to support the NHS. It's not here to replace it. But it's also very important to acknowledge that, clinicians who work in a private setting are actually trained by the NHS clinicians who are probably still working in the NHS, like myself. All of our consultants that work here, it's a consultant-led clinic where even our ultrasounds are done by consultant radiologists that are still working in the NHS and then work with us as well. So acknowledging the fact that, private healthcare, private clinics, the clinics that have CQC, GMC registered doctors are regulated clinics and offer you the same quality care, if not less, if not more, the same quality care that they would get or expect from the NHS. Mm-hmm.
It's interesting points that you're raising. There used to be a notion many years ago that private healthcare was to get completely indulgent and unnecessary treatments done. Whereas nowadays, from what you're saying, there's a lot of necessary treatments and solutions that patients need that are simply not available on the NHS, but without which could be detrimental to their health.
Definitely, and with the International Women's Day approaching, when you talk about access to healthcare, when you talk about the effects it has on our health, especially detrimental effect due to the lack of access in a timely manner, the slogan for this year's International Women's Day is Accelerate Access, which essentially is around women's health services. So at the House of Health, we are very, very passionate about women's health. I myself have suffered from late miscarriage. I am an ambassador for Tommy's, which is a charity that looks into miscarriages, the reason why women have it, and invest a lot of money into this research. And at the House of Health, I've set up a fertility clinic, which is run by a consultant gynecologist who has more than 33 years of experience within the NHS, and a consultant urologist that looks into male infertility. And the access to this care is almost immediate. I mean, you can get an appointment within the week. So there is a lot of focus for high quality, high-end care with efficiency, because that is the future. I mean, how unfair is it for a woman to have to wait for 7 to 8 years on an average to get a diagnosis of endometriosis? Now, I suffer from it. I suffer from adenomyosis. I've suffered from, fibroids in my uterus. And the first time I actually ever had a gynecological surgery was when I was only 15. So, and it was an open surgery that I had, a laparotomy. And then when I was 17, I had my second surgery. So I know how painful it is for women to sit there and suffer in silence just because they're not being heard. So we take, these health inequalities very seriously here. And if you look at the way I have designed the services, we're very well integrated, which means that we do inter-house referrals. We're very quick at picking up referrals. And we have a team of doctors, healthcare practitioners that work in sync.
Wow, that's incredible. You mentioned earlier on that you're a great advocate for, you also mentioned women's health and longevity. And I think one of the pioneers, certainly in general practice, was probably Rangan Chatterjee quite a few years ago, and he's written several books about various pillars for good health and living. With your extensive experience as a GP in the NHS, particularly specialising in women's health, what do you identify as the most pressing challenges that women are facing today? You mentioned waiting lists, but what other issues?
Not being acknowledged, not being listened to, especially if you're a woman of color. We see that there is this stigma around accessing care because nobody will take you seriously. I mean, there is a very derogatory terminology that is used for women of color, specifically those who are from the subcontinent, whether it's India, Pakistan, Bangladesh. It's called BB syndrome. You know, doctors will not take them seriously, especially if they are presenting with aches and pains which are non-specific, or if they're presenting with symptoms that the doctor simply cannot acknowledge. So I think it's very important for me, because I'm in a position of privilege, to advocate for these women, because I am a woman of color. And I feel that looking at my aunties, my mother, my grandmother, resilient women who probably did not have access to the kind of education or the opportunity I had. So, you know, within the NHS, we already know, and, you know, we had a paper that was published in the Lancet in 2021. We have had many BMJ articles talking about health inequalities, especially in people of color from the ethnic minority group. And we saw that during the COVID-19 pandemic, when it came to the number of deaths, there was simply no comparison between the people who were from white backgrounds and those who were from the ethnic minorities, purely because of these health inequalities, because of their lack of confidence within the healthcare system. So, you know, I know that we are a private clinic, but we attract a lot of people who are from the ethnic minority backgrounds. And the beauty of the way their culture works is that if an auntie or an uncle or a parent is unwell, the family will get together, they'll pool in money, and they'll get them seen. So, you know, it's something that we are seeing since we've established this clinic.
You've been very open about your experiences, and I think people will really connect with that. So we appreciate that. Talking about professional burnout, I'm sure you've seen it amongst your colleagues, working within the NHS and with the frustrations that lie within what you're trying to establish. How do you yourself prevent getting burnt out in a system that isn't designed for what you want it to do?
It's a very complex question to answer, because what do you do when there's so much red tape, bureaucracy, when nobody's listening to you, when a GP contract is being decided by anybody apart from a GP partner, where contracts are being imposed, where there are cutbacks, where you know, different services are being decommissioned, and every single drop of goodwill has been sucked out of the clinician. We've seen that the NHS has disintegrated and really gotten to its knees in the past sort of 14, 15 years. I am very hopeful, and I pray that this government helps the NHS thrive, because we do really need it. We do really need it in the background. I mean, private clinics can only do so much. And when it comes to an acute problem, illness, of course we can support, but when it comes to chronic conditions, when it comes to palliative care, when it comes to cancer treatment, the NHS is doing a phenomenal job. And I don't think that that can be replaced by private healthcare, not in the next 10, 15 years anyway. So when it comes to burnout, I think what has happened is that, what I have seen is that, and you'll be shocked to know this, you know, most people that qualified with me have left the United Kingdom.
Wow.
And they have moved to different parts of the world, Australia, Canada, UAE. I think I am one of the very few who are left behind in England. And as you can see, I've embarked on a private, you know, a private healthcare journey. And I think this was my way of remaining sane. Otherwise, you know, I would have crumbled by the pressure within the NHS. I mean, the problem is that you simply cannot give your patient the service that they need, that they have the right to receive. And it's just shocking. I mean, there is a patient who has paid their taxes all their lives, they've worked really hard, and now they're retired, and they're hobbling around because they simply cannot see a trauma and orthopedic surgeon for 2 years. I mean, how can you even tell a patient that? So I used to feel that whenever I speak to my patient, I almost always have to apologize first for the inconvenience that the healthcare service is offering them. And it was just very hard, I think. And so I have sort of branched out in the private arena, and I feel that yes, people have to pay for the services, but they get a much better service.
And I guess that gives you more fulfillment.
Yes, as a clinician, because remember, Atif, we are clinicians. We are trained to do the best for our patients, and it's very difficult for us to accept defeat when it comes to not offering high quality care, whether it's within the NHS or outside the NHS, because that's the way we've been programmed. I mean, I moved to the United Kingdom in 2013. I finished med school. I came here, did all of my junior doctors training here. I did all of my GP training in the United Kingdom. And this is what the NHS treats you. It's a great service. It trains you well. And what does it teach us? It teaches us that we have to offer high quality care to our patients. And when we cannot do that, that adds to the frustration. And this is why I see my colleagues burn out now. And of course, many of my colleagues have taken time off sick, especially during and after the pandemic. I think that was the last nail in the coffin.
So you mentioned that you came to the UK in 2013 and you were born and raised in Germany.
That's right, yes. So I am born raised in Germany. I'm multilingual. My mom is from Afghanistan, she's Persian. My dad is from Pakistan. And I speak Urdu, Punjabi, Farsi, German. I speak many languages, a bit of English as well. And it's really helped me because I feel that I am very open-minded, very accepting of different cultures. I don't get shocked by, the weird and beautiful things that come with different cultures. I mean, if I see an auntie who's saying something that's completely ridiculous, I would be understanding of it because I've heard it before from an auntie myself. And I think when people see someone who can speak their language, it's especially patients. They're at ease because yes, we're ever so blessed that we have interpreters and people who can come and the different languages or via third party that we use. But when you can speak the language that they speak, I think it's just much more comfortable for them to be able to open up and tell you what their problems are.
It's interesting you mentioned that because obviously with GP training here, there's a lot of focus on patient-centered consultations. Yes. And there's a sort of a formulaic way that we consult and we derive information and body language and things like that. But it's restricted to the English language. And I've always been curious that when you're consulting in a completely different language and culture, do you have to, my guess is, do you have to adapt in a different way or ask questions in a different way to get answers that will help you make a diagnosis or a management plan?
Definitely. It's not the English way of taking history. It has to be very personal. You have to be very non-judgmental, and if they are giving you a certain cue or telling you about something that you simply cannot understand, you've got to keep digging till you get to the right questions, get the right symptoms, because sometimes they come up with very non-specific symptoms. Like, for instance, they'll say that they can feel a bubble of air somewhere in their gut. I think if we were to use a language line for that, it would be very difficult for us to quite understand what they're trying to say, because there's no such thing as a bubble of air. So, it's just, I guess, a different style of interviewing our patients.
And of course, with so many languages, that's another offering that you offer at House of Health,
which
is
definitely
unique to this centre.
Yes, unique to the centre. And the House of Health, the reason why I named it House of Health and I didn't call it sort of, I don't know, Medicare or Medi-something, because I don't want it to be clinical. I want this to be a place of solace for the doctors that work here, welcoming. It's a family. And there's no hierarchy. You come here and the clinician will cater to your needs. They will listen to you. It's a House of Health. And we're not promising you that, you're going to come in limping and you're going to walk out, running. But we do promise you that we're going to listen to you. As I said before, It's a doctor-led service. All doctors are GMC regulated. Where there is regulation, there's credibility, so there's simply nothing to worry about.
Excellent. Now, as I mentioned before, you're very well known. You've been a TV presenter, you've been on radio, and often an expert when it comes to health news, politics, things like that. So balancing your roles as a medical professional and as a national TV health commentator, how do you manage the interplay between media, expelling myths, maintaining your professionalism, bearing the flag for the NHS? How do you balance all of these roles?
Well, I started working for media when I was really young. So I started when I was in A-levels, and I have worked in media since 2003. And I have taken on very many roles. I used to do a morning show, then I started doing political commentating, and then I ended up in England, and then COVID happened, and BBC Asian Network was looking for an Urdu speaker, so I do speak Urdu as well. And someone said, oh, wait on a second, there's a GP in Birmingham, she speaks really good Urdu, so why don't you use her? And I remember that they contacted me via Twitter. And I did one video for them. They were like, that's it, we want you. And I did loads of videos for them. And that was when I sort of recommenced my media career here in the United Kingdom. And I simply love doing media. It's something that comes to me very naturally. I have, my father, he is a well-renowned Pakistani writer. He's written many books. He's very well renowned in the Pakistani circles. Very well-esteemed gentleman who put in a lot of training, I think, in me, a lot of investment whilst I was really young. So I remember that there used to be this Jashan-e-Azadi, we call it, like Independence Day program in Germany on the 14th of August. My dad is Pakistani, and I remember that I used to be really, really young, like 6, 7, 8, 9, 10 years of age, and he would put me on stage, and he would make me speak about Pakistan, and I used to do lots of speeches and things. So it started whilst I was really young. So I have no camera fear. It comes to me very naturally. And I always wanted to become an actress. I never wanted to do medicine. But my dad was he was a tyrant, let's put it that way. And he said to me, Beta, whilst I'm alive, you cannot become an actress. It has to be medicine. Or you get married to someone I choose for you. This was after I did my A-levels. And I was like, Dad, I'm your daughter. I'm not going to marry someone you choose for me. I'll do medicine. That's how I ended up in medicine. So, I think the balance, the way I strike it is because I'm incredibly lucky. I have a very good family support. My mom is really young. She's only 60. And she has helped me raise my first son, who's going to be 12 this year. And I have an incredibly supportive husband. He knows that I am different. And he's just let me chase my dreams all my life. We met when we were very young, so we met in first year med school, so we've been together for 20 years now, and I think we've grown up together in a sense. And I don't want to take the credit for balancing my media life, my private work, my NHS work, my education throughout these years all by myself. I cannot take that credit. Without the family support, the network of people I have around me, it would be impossible.
Wow. It's a big pat on the shoulders to everyone involved. The media is interesting because obviously when something happens, particularly when no one's really sure what's going on, and the media will look to medical experts for either reassurance or tell us the truth. How do you balance the sort of doom and gloom type information or sensationalism to what people really need to know? But how do you do that?
Look, what I would say to this is that I'm not English. You see, I was born and bred in Germany, and we say things as they are. There is no sugarcoating. So what you see is what you get. And I think this is one big reason why the national television in the United Kingdom loves me, because I will say things as they are. And I genuinely think that we need to support our workforce, our junior doctors. We need to support our people within the NHS. And it needs to be said as it is, because unfortunately when you pick up different newspapers, there's a lot of blame on clinicians. They're called greedy, they're called all sorts of things. And sadly, from clapping during COVID-19 pandemic. Do you remember when they used to clap for us?
Can't forget.
Yeah, they used to clap for us. They then later started slapping us. So it's very important that we do have a place in media as clinicians, so that we keep the stories in check. We're able to give credible information, and we're actually able to tell the public exactly how it is in those healthcare systems, within the system, how our clinicians feel. Because we're working very hard, whether we're working within the NHS or whether we're working in a private setting. As I've said, we've been programmed to offer high quality care, and we're burning out as a workforce. So when I am sitting in that chair, I know that for me, the most important thing is that I'm carrying the responsibility of all my colleagues who have faith in me, and I'm representing them. And it's very important that I say it exactly how it is.
Which brings me on to my next point. So looking at latest news recently, and you run a private health clinic, you must have been inundated with people struggling to lose weight and requesting Ozempic or other type products. And then, of course, the media will then announce that there's been, so far 100 or so deaths associated with the use of these things. And best thing is go and consult your doctor before you start any of these things. When it comes to innovative new treatments and things which are really high in demand, which show early effectiveness, what's your ethos in terms of delivering these type of services, and also reassuring patients that they're relatively safe for as much as we know? How do you...
It's a very good question. So at the House of Health, we're extremely evidence-based. We're holistic but evidence-based, and we have a very robust system in place. So when it comes to our weight loss clinic, it's a pyramid. So the pyramid is, on top of the pyramid, we've got a consultant endocrinologist. We've got a GP who has a special interest in weight loss and done a training in that. We've got a dietitian, we've got a personal trainer, and we've got a diet coach. We even have a mental health coach that helps people, talks them through their difficulties, their different habits that they've acquired throughout the years, like comfort eating and things. And the way we support our patients is that we give them a comprehensive package. We do not prescribe anything that is not approved by NICE or where MHRA has a problem. That's simply not. We go by the book. So yes, we'll offer you medications that are new in the market, but only when they are well researched and when they're safe.
I want to talk about women's health, reproductive medicine. So as an advocate for women's health, an expert in women's health, and also an expert patient, what recent advancements or emerging treatments or trends do you find promising, and how are they being integrated into patient care, particularly with what you're offering?
So I think the first thing that has been a great advancement within the healthcare system in general is remote consultations, video consultations. So that's been great, because this means that we have a wider access to patients who are in different parts of the country, and they can access our healthcare system, our clinic. Secondly, you've seen that with COVID, we've seen that there has been a high rise in home testing kits, STI testing kits, lots of remote testing, which I think is phenomenal. And it's something that we can offer from our clinic as well. So we can post out a testing kit, and we have an STI clinic that we run at the House of Health. We have a fertility clinic that we run at the House of Health with the help of our consultant gynecologist and consultant urologist, and we have home testing kits. So the House of Health sends out blood testing kits, which are home testing kits, so you can do your own blood tests via finger prick tests. And I just feel that these advancements have been great in terms of accessing care, because remember, back in the day there was no such thing as remote consultation or remote testing kits, which essentially meant that if you're in Birmingham, you can come to the House of Health, but if you are somewhere in Bradford, then you simply cannot, because it's too far away, or in London. But now I think we simply have been able to offer our services to anyone.
And how do you find providing remote services? What's the pickup been like?
It's been great. It's been great. It's been really good. And I just feel that video consultations put you at ease, because you can see the patient, they can see you, you can understand their body language. It's so much more better than telephone consultations where you can't see the person. So, you are able to have that rapport with your patient. You're able to understand how they're feeling, and it is just phenomenal.
In your experience, with current GP consultation lengths and referral times, is the NHS geared up towards diagnosing menopause early and treating menopause effectively?
The NHS is extremely underfunded at the moment and is on its knees. When it comes to menopause care, not every GP is trained in it, which makes it very difficult for the patient to access that one or two doctors within the GP surgery that have actually done a diploma or know much about menopause. Menopause is not one size fits all. And we need to understand that. And the ethos of my clinic, certainly, the way we've run the House of Health, is that every single consultation is tailored to the patient's needs, whether it's a trauma and orthopedic consultation, whether it's a menopause consultation, whether it's a sexual health one, because every person is different. You were asking me about the weight loss clinic, and you won't believe how different everybody is, because for some patients, the lowest dose is the best dose and they can be on it for months and they'll lose lots of weight. For other people, even the highest doses do nothing. So every person is really different because of our genetic makeup, because of our ethnicity and everything. And I feel that lots of women come to our clinic just because they're unable to access care. Menopause, I'm really glad that we're talking about this. Now in 2025, there'll be 1 billion women who will be suffering from menopause, but only 1 in 10 will be able to access care. This speaks miles about the way the service is run. So it's very sad that, you know, women are left in limbo. It's life-changing. I mean, you can have these very debilitating symptoms. It can affect your relationship with your partner, with your children. It can affect the way you function at work, especially women who are in high functioning jobs. For them, I think it's a huge hit. So this is why we have a menopause clinic at the House of Health, and you can access it whenever you like.
I think you've hit the nail on the head. Certainly I feel extremely challenged if a woman asks me about various types of treatment, knowing that you've got 8 minutes, and I'll say right at the beginning that today we're not going to make the decision as to which treatment we're going to have. This is simply a fact-finding mission. We're going to probably have to come back and maybe have 2 or 3 consultations. Have you found that your uptake for menopause consultations has risen exponentially in the last few years?
Yeah, definitely it has, because there's a lot more awareness and acceptance around it. People are more accepting of the fact that a mom is menopausal, or a wife is menopausal, or a sister is menopausal. I think before this, women were just expected to put up with it and get on with life because every woman has been through it. So what's the big deal? But there is a big deal, because women are losing their bone mass density, they're suffering from brain fog, they're having hot flushes. It's very difficult to function when you have so many symptoms going on. So I've had the privilege to advocate for women on different platforms, especially when it comes to menopause, because I feel that, you know, we as women are expected to just put up with things, whether it's period pains, whether it's menopause, whether it's childbirth, anything and everything. We just put up with it. It's normal. It's okay. Other women have as well. I think it's time that things change, and I can see that shift now, which is very encouraging.
And coming back to the challenges of different cultures, different faiths, different languages, have you found that when you consult women who are suffering menopausal symptoms, but they've never been able to articulate it because the clinician hasn't understood, or because it's culturally just get on with it, this is a Western thing, have you found that you're doing many more consultations? Definitely, much more. And I think when women from the South Asian background come and see us, they feel at ease, they feel that someone is actually listening to them. And because they can consult in their own language, which is Urdu, Punjabi, Hindi, they feel heard. And bear in mind, I mean, there's still very many women out there who have absolutely no clue what the menopause is. I mean, they're just coming with aches and pains, or they're just coming with brain fog, or they're just coming with weight gain, or they're just coming with hot flushes, and they simply do not know what's happening to them. So, you know, I think it's almost our responsibility as clinicians to cater to their needs, and I feel that the House of Health has given me that platform where I actually can do that. And in those sort of circumstances, who initiates the consultation, or what's the reason for the initiation? How do they find out about you? And is it the woman herself that will contact you, or would it be a family member? I'm interested to know how they end up coming here.
It's usually a family member that is concerned about, this person in the family. It could be the son, it could be the husband, because that is the way the family dynamics are. So it's more, I think, sort of or a daughter who's worried about their mom, and they'll book them in, and that's how it usually happens. But having said that, I do a lot of videos. I mean, we've got a TikTok account, we've got an Instagram account, YouTube, we're even on Twitter, and we do lots of informational videos and things. And I feel that our uptake on these social media platforms is quite high. And sometimes people will just inquire and they'll say, well, we've seen Dr. Anita Raja on as TikTok, for instance. Can we book with them? And they'll come in for one query, and I'll be like, well, actually, do you think this could be the menopause? So, for instance, joint pain, or insomnia, or lack of sleep, or brain fog, and but I guess you need to have that expertise to be able to steer the consultation in the right direction.
Now, I know this is probably your acting skills coming to play. You've got such a big responsibility, and you're carrying so much on your shoulders. Being a mum, being CEO of this glorious clinic. Being the social media expert, being savvy on TikTok, and I can guess what part of the answer is going to be. But how on earth do you manage all of these things?
I don't know. I get this seriously. I get this question all the time, and people actually ask me, "Do you ever sleep?" And I think I probably don't. I don't know how I do it. I don't think. You see, the way I look at things is very different from the angle from which you're looking at it. For me, this is all very natural. I don't make much of an effort. And this is just the way I have led my life. I've always worked. So I started working since I was a teenager. I had a full-time TV job, and I was in med school at the same time. And I remember what used to happen is that I'd finish my uni, and the TV car would be standing outside to pick me up for my show. So this is the way I've led my life, and I just think that I'm high functioning, and I enjoy it. I keep my mind busy, and that helps.
That's amazing. So do you think there could be an acting career somewhere down the line?
Well, I did ask my husband one day, I was like, do you think I'll still end up being an actress? And he was like, yeah, you might. I might get a grandma role sometime in the next coming years. I don't mind having that. But I genuinely think that is something I always wanted to. I don't know if I will be able to do it, but yeah, it was always a dream.
And I mean, following everything that you've established so far, which is a great deal, and you should be commended for that. What are your sort of plans, expectations, business developments going over the next few years? So
we've just opened a branch in Manchester, which we started in Jan, and of course we're thinking of expanding, and we're also looking in Solihull at the moment. And I think we're going to be not just national, but I hope international. And I hope that in 5 years, when you interview me again, it's not in the United Kingdom, it's somewhere else. Incredible, fantastic aspiration. We wish you all the best in your career, in your business development, and your flourishing social media presence. I think what you do for so many people is incredible, and you're an advocate for so many people, and we really appreciate that. Oh, thank you so much. Thank you so much for having me on your show. Thank you. It's my pleasure. Thank you. Thank you for watching Health Chat today. Sadly, I'll be taking a break from hosting the podcast as I embark on a career and family move to Canada. I'll still be dropping in from time to time, but I'm sure you'll be in good hands with our new host. I'd like to thank our Health Chat team and the health group for their support in bringing this podcast to life. And most importantly, I'd like to thank our brilliant guests and our audience for joining these important conversations regarding health and social care. Take care and see you soon. We are the Health Group. We work with new and existing healthcare providers every single day, from private clinics to adult social care services and NHS trusts, to ensure all providers are compliant with regulations, have a culture of excellence, and are delivering exceptional care.